Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Welcome to MedAxiom HeartTalk, and today we have the honor of talking with Dr. John Erwin III. He is the Chair of Medicine for Prisma-Health Upstate, Academic Chair and Professor of Medicine at University of South Carolina, Greenville, and we're going to talk about From the Field to the Frontlines, team building lessons from the Gridiron. So you might be asking, why are we talking about the Gridiron? Well, it will all make sense. Welcome. We appreciate you joining us today.
Thank you. Great to be here.
All right. So obviously you have achieved a lot in your healthcare career, but you started as a football player. In high school, that was the goal, to play in college and potentially get to the NFL. But those dreams were dashed. But what's interesting is you still kind of use what you learned in that team building and the desires to play football in what you do every day. So kind of give us a little backstory on your life.
Yeah, so growing up in Texas, football is just a rite of passage. And growing up, I had the same aspirations as every other little kid in Texas did, to play for the Cowboys. Yeah. And so when I was in high school, I thought, either when I grow up, I'm going to be playing for the Cowboys, or I'm going to be a doctor. And so I ended up with Plan B, but learned a lot of lessons in my attempts to get to the NFL.
Yeah, my husband is from D.C. and he's a Cowboys fan too. So
that's
not just little boys in Texas.
No Commanders fans.
Yeah, no, not at all, not even close. You know, it's interesting when you talk about team building, and everybody in football has a role. And they have to do that role well, and they can't really cross over too much and do other people's jobs. Do you see that being something that's really instrumental in healthcare as well?
Really do. I see so many parallels there because for us, I'm a cardiologist. So for me to do my job, it takes a lot of other people surrounding me to give the right support that play the different positions that I need to be successful. So absolutely translates.
Mm-hmm. All right. So what are some practical ways that leaders can really build trust quickly within newly formed or frequently rotating multidisciplinary teams?
You know, I think the key is just getting to know your team members. It's very important, as fast paced as our world is these days, that we don't really know the people that we're working with sometimes. And so I think the key is really trying to learn people's backgrounds, you know, what their passions are, what they like and dislike, you know, a little bit about their family, a little bit about what they hope to aspire to as their career unfolds.
Yeah, you showed a picture where you talked about your team and how everyone's kind of doing something different. You know, some didn't make it while others have reached all their goals and even beyond. But knowing that about people and where they come from, what they've endured, you think that really helps and able to be a strong team, because you can they lean on you when you know they need it and you can respond appropriately.
No, absolutely. I think knowing where people are coming from really helps a lot in determining how best we can help to either motivate, support, encourage, sometimes even correct when we need to, but and how to do that too. So people that may not have had the same upbringing I did, where parents were very supportive but had high expectations of me. Not everybody grew up that way, right. And so we need to be able to understand that about people so that we can guide them to be their best selves.
Yeah, because we need each other.
Absolutely.
I mean, especially now more than ever. You know, we think about during COVID, everyone kind of had to learn new roles and work together in a different way.
Absolutely, yeah, and being able to be adaptable and innovative is so key to that, and COVID pointed it out as much as anything could have.
That's important. Yeah. So how can we better align individual roles in healthcare teams to avoid overlap or gaps in responsibility?
Yeah, I think I worry less about the overlaps and more about the gaps, because usually if there's a gap, it's our patient that's falling through that, their experience of going through the healthcare system. If you've had to navigate it yourself or help a family member do that anytime in the last couple of decades, it's very complex. Even myself, being in healthcare, having a lot of connections, a lot of network, it can be very daunting. And so I think the overlap is actually key, that we do have roles that an individual has to play to make it work for the patient, but we can't, we need to have somebody standing alongside them that has a complementary role that prevents people from falling through the cracks.
Right. What qualities do you think make up a good healthcare team?
I think the biggest thing is compassion and empathy. You have to start there. I mean, what we do is a people job, and so I think a lot of times you get people in medicine that are very scientifically driven, maybe don't have the right social skills. And so we may be choosing who becomes a physician, especially a physician. I don't think that's as big of a problem in nursing. Nursing are always naturally compassionate, empathetic people. In medicine, a lot of times as physicians, I think we focus too much on the science at times and less on the experience that patient is going through in a stressful time.
Yeah. Thinking about coaches, and going back to the football, coaches can be tough, right? I mean, if you make a mistake, they're going to hold you accountable. It's very easy to do, and sometimes the whole team will have to join you in that consequence. How can healthcare leaders foster that culture of accountability without creating a fear-based environment?
Yeah, that culture of being safe, of having that psychological safety is key. And I think the biggest part of that is to correct the behavior, not the person. To give an analogy of football, if I took the wrong step to try to make a block, that coach needs to yell at me and say, you have to take this step and this is why. On the other hand, in healthcare, we sometimes tend to internalize when someone corrects us and take it personally rather than to understand this is a way to get better.
Right. How would you say giving that feedback? How can you give it so that people don't necessarily take it personal?
Usually I'll start out by talking about I'm so happy to have you on my team. I know the things that you bring to the table. Some of our expectations and the culture of our workplace are X, Y, Z, and we all have to play within those confines because it's important that we work as a team and not as individuals.
Yeah, kind of sandwiching it. Don't forget the compliment on the back end.
I usually leave the.
Do you? Oh, tell me about that.
Set the expectation at the end. So
yeah.
I will usually start off with the qualities that I know this person has, the skill sets, the whatever personal qualities that they may have that make them an important part of the team. Then I will call out, okay, in this instance, we had this problem occur. Here are our expectations moving forward, and here's ways that we can help to prevent that from happening again.
Solutions.
And I try to just leave it with that and make sure that they understand, make sure that they have a chance to give me their perspective, because sometimes we don't have the whole story. And so I think it's important that they felt heard and felt that we're not chastising them as a person. We're just trying to change the behavior to make a better outcome, both for our team and for our patients.
Yeah, I love that. So what's one technique from athletics that you believe is underutilized or underused in healthcare, but could significantly improve collaboration or innovation amongst teams?
Yeah, I talked a little bit about the difference between a game plan and a playbook. Playbook is more about the tactics. I think the biggest area that we're running into problems in medicine now is that as we develop strategies, there's a lot of top-down sort of forcing things into the tactics. The people that understand the tactics the best are the ones that are actually doing it. So our office staff, our nurses, our physicians that are taking care of the patients, we need to tell them, here's where we want to get. You tell me the steps that we need to take to get there tactically. And I think we bleed in from strategy to tactics a lot. And again, strategy has to be the overarching organization that's setting the North Star. But then they have to hire the right people and remove obstacles to allow those people then to do the work that they know how to do better than the top line leadership does, and let them make the tactics that are going to help the patient get the best care.
Do you have an example where you kind of saw that work beautifully?
Yeah, I did. In one of the institutions that I worked in for a while, they set a rule that if a physician was going to be in the clinic, that they had to be there for at least a 4-hour block. I can understand the rationale behind that because we've got staff that are going to be working there during that 4 hours and we want to keep them busy. But the balance measure to that was that many times doctors who were maybe attending on a hospital service would break away from the hospital, try to run over to the clinic and see a few patients just to help the patients, to help get throughput, to help gain access. But if you set this staunch, you got to be there for 4 hours, it doesn't allow that flexibility to do what's right for the patient and what's right for the system as a whole.
So that is good. So they changed it.
Yeah, they did.
Oh, awesome. All right. Dr. Erwin, thank you. Great things to think about.
Absolutely. Thank you so much.
And we certainly appreciate you joining us on this Heart Talk.